You're listening to Psych with Mike. For more episodes or to connect with the show with comments, ideas, or to be a guest, go to www.psychwithmike.com. Follow the show on Twitter @PsychWithMike or like the Facebook page @PsychWithMike. Now, here's Psych with Mike. Welcome into the Psych with Mike library. This is Dr. Michael Mahan, and I am here with Mr. Brett Newcomb.
Hey, how are you?
I'm great. So I started the recording and caught us laughing because I was doing my vocal warm up.
Yeah. We may not amuse others, but we certainly amuse ourselves.
Well, I'm sure if we're amused, that's all anybody cares about.
Well, that's because we've both been accused of being narcissists at times.
Oh, man.
Am I good at that or not?
Good at the segue?
Yeah.
Yeah, it's almost like you are a professional.
Yeah, no kidding.
Yeah. So, this is a term, and actually we had talked about doing a show on narcissism, and we've actually done a show on narcissism. Do you remember that?
No.
We did, and it's been several months.
Huh.
But I was looking back through, and I was like, oh, I don't think we should do another show on narcissism because...
Oh, do you know why they call them selfies?
Why is that?
Because they can't spell narcissist.
Oh, that's true. I have a problem spelling that.
Yeah.
But so I thought, oh, I don't think we should do another show. But then I looked at the numbers, and it's actually our number one rated show.
I think there are an awful lot of narcissists out there, or there are an awful lot of people who think they're involved with narcissists,
right,
and feel somewhat hopeless about it.
Right. And my, I don't know, I don't want to say concern, my issue with that is this. It's much like sociopathy. You know, people think that they're a sociopath or think that they know somebody who's a sociopath, and then they go on the internets and, the Al Gore creation, the internets, and find these, take this quiz and find out if your partner's a narcissist, find out if your partner's a sociopath.
That's not qualified research.
No, there are absolutely no actually clinically supported tests for borderline personality disorder, narcissism, or for sociopathy. So anybody who thinks that there is...
So let's clarify that for a minute. Those are three personality disorder classifications.
Yes. Correct.
And the research shows that the dividing line among them is tenuous at best.
Yes.
And so you look at a list of criteria. They have these characteristics, they have these characteristics, and depending on the individual on any given day, they could be classified any one of those three things: narcissistic, borderline, or sociopathic.
Yes.
So when we talk about narcissists, we believe, I think you and I both believe, everybody has narcissistic traits in their character.
Oh, you have to.
From childhood.
You should.
Grandiose narcissism of the child. But then some people have such a consolidated picture of traits that are narcissistic that they can be called narcissistic personality disorder. And so that is what we want to talk about today. If you are involved with someone, a boss, a partner, a neighbor, that is narcissistic, there's going to be inherent frustration for you because the empathic feedback that you get in a normal or healthy relationship is not available with a narcissist.
And that, for me, is what would be the key defining characteristic of all three, and why all three are on the same continuum. So they all three have a connection or disconnection, as it were, to empathic responsiveness.
Yes.
And they manifest in different ways, but all three of them are really about, I don't get reciprocity back in my empathic connection with you in a way that makes it feel weird.
So the narcissist, according to the legend, Narcissus fell in love with himself, looking at himself, a reflection in the pond.
He was a beautiful man.
That's according to the legend. But he had a girlfriend named Echo, whose job was just to repeat whatever he said and become his voice. And that's what narcissists look for in relationships. They look for echoes. Somebody that'll say back to them what they say, or say for them to others what they have said. Narcissists as a category are often extremely successful. They're often very bright, brighter than the norm, but their social relationship capacities are extremely limited. They can perform on camera, as it were, but then the lights are on, but nobody's home.
And so let's elucidate that a little bit more and talk about, so then what is the difference between that and borderline and sociopathy? So for me, the difference is, so narcissism is this idea of arrogant conceit and I'm all about me, and then borderlines are all about trying to find the diversiveness, right? So I want you to love me, but I don't really believe that you can love me, so there's always going to be a test or something that you have to meet.
I hate you, don't leave me?
Yeah, exactly. And then...
Who wrote that book?
I don't...
It's a psychiatrist here in town. Gerald Kreitzman wrote I Hate You, Don't Leave Me.
I did not know that.
Yeah.
That's interesting. So then in sociopathy, it is the extreme manifestation of the inability to experience empathetic responses when in connection with other people, or the inability to connect other people because you don't have the capacity to feel empathy. But all of these disorders at some level are about when you're in relationship with these people, you don't feel an empathic connection, or the empathic connection feels odd.
So you don't, do they?
I don't know. I don't think that sociopaths do. I don't know whether narcissists or borderlines do, but this is, for me, this is the difference. So when I'm in conversation with a person who's borderline, and this may make sense to people or it may not, it may make sense to you or it may not, the reflection
depending if you're talking my good self or my bad self.
Yeah. The reflection feels oily. So it feels like that when you project the empathic sense onto them, that it's like oily. It like skims around the outside, and what you get back is like tainted.
Yeah.
When you project that into a narcissist, it feels like a black hole.
Right.
All of the energy gets absorbed all the emotional energy gets absorbed out of the room and into them. And then when you talk to a sociopath, it feels like you're talking to a blank wall.
Right.
Yeah.
And when you talk to a healthy person, you project that empathy out to them, and they absorb it and reflect it back to you, and you feel it coming back.
Just as simply as the reciprocity that we have when we're on mic. We very rarely talk over each other. We very rarely don't know when the other person wants to talk. And I'm not signaling you. I'm not saying, hey, Brett, look at me, I'm going to talk.
Well, but it's that kinesthetic dance, and we have an attunement to that, and narcissists don't.
Right.
Sociopaths may have it but don't care.
Right.
They use it just to manipulate.
Correct.
Borderlines have it and don't have it depending on which side of the coin they're on.
Exactly.
So.
Yeah. So then you get into whatever kind of relationship, whether it's a committed relationship or a work relationship or just a social relationship with people who have these personality disorders, and what you get back doesn't feel congruent with what you expect, and then that feels odd. But this person may be very charismatic. They may be very dynamic.
Oh, they are. Most of them that I've ever met are.
Very attracted to them.
Yeah.
But you don't get back, reciprocity-wise, you don't get back in that emotional empathy. And so then you want to be in this relationship, but then it feels odd. So then what we wanted to talk about was, can a person be in a relationship with one of these individuals and survive?
So there are levels of relationship. I mean, if I work for a narcissistic boss, maybe I get seduced by the initial presentation, the charming, glittering presentation of we're going to do great things, we're going to climb the mountain, I need your help, come work for me. So I've taken the job, and now I've got a mortgage, and I've got bills, and I can't afford to lose the job, and I want to keep it, and maybe I still think the company's worth working for. How do I keep from getting burned in my relationship with the narcissist? How can I have a conversation with them and tell them, here's the project I'm working on, this is what I need to do, this is what I've done, how does this, when the narcissist needs everything to be a reflection of their thoughts and their needs. So you have to learn that, and you have to figure out how to present to them in ways that they are more likely to hear you. And you have to understand that you aren't going to get any strokes back. The only thing you're going to get out of it is marginal safety until the next time. So it's day after day challenge for you to stay in that environment. So, and if you're in an involved or romantic relationship or a marital relationship with somebody that's a narcissist, that makes it even harder. It makes it worse, because you have to have that communication dyad that's really one directional.
Right.
I mean, the words go back and forth,
right,
but the emotions only go one way.
Right. And so you started this off by saying that you've been accused, and you know for a fact that I have been accused of being a narcissist.
It wasn't me, I promise.
I know it wasn't you, but you know for a fact, because you've been in the room when I've been accused of it. So
I have. And you've been gone from the room when you've been accused of it any number of times.
Well, that's good to know. Yeah. Not surprising. But both of us also are extremely empathically reciprocal.
Yeah.
And we know that because we've been very successful as psychotherapists, and we wouldn't be successful in this field if we weren't capable of being able to be empathically connected with another human being.
Exactly.
So that then precludes...
We're almost as good as Dr. Phil.
You think?
Yes.
I'm hoping you're being facetious, because I believe I'm better. But okay. So that would then preclude, according to our description of what a narcissist or a borderline or a sociopath is, preclude us from being able to be in that diagnostic category.
Well, except many years ago, Dr. Fitzgibbons and I went to the Einstein Institute at Yeshiva University for a 10, 12-day course on narcissistic borderline personality disorders that was taught by Otto Kernberg, one of the two major names.
I did not know that you had actually been in his presence.
Yeah.
Wow.
And
that's
one of the things
really
that I
impressive.
remember and have always retained from that workshop. Kernberg says that if you have a narcissist in therapy, say you have a married couple and they come in and the husband's a narcissist and the wife is begging for support and help, and for whatever reason the husband comes for a while before he sabotages it. If you have him in therapy, what you need to understand is that the only thing that you can accomplish is trying to keep him coming, and that you have to learn how to do effective reflective listening, and so make him aware that you are hearing and understanding what he's saying. But that if true personality change is the goal, it's not possible for them to do that until they reach somewhere between late 40s, early 50s, and then only if they have a real desire and are willing to work at it. But at that point, you can make interventions that can lead to personality change. The only other thing you do is just keep putting band-aids on it and help them hold it together until they get that old.
Well, so let's get really geeky. So Otto Kernberg and Heinz Kohut were the two guys that were most prolific in this area of
and
borderline.
Masterson.
Okay, but as far as what I've studied is Kernberg and Kohut. And everything that I've read from what Kernberg put out is that he genuinely believed that narcissists and borderlines were incapable of real substantive change, that they might be able to fake the reflection. But Kohut believed that you could actually make an intervention that would substantially change the way that the individual was internally structured.
I think that's the correct interpretation. Although Kernberg did say once they reach 50-ish, if they're in enough pain and want it badly enough, there's the potential. And
for substantive change in the at a foundational level in the personality.
That was my understanding.
Okay. So, but regardless, both of them would agree that that the way to interact with these individuals was genuine, sincere, reflective listening that was focused on their needs and oftentimes did not get the needs of the other person addressed or met. And that you have to accept that as the price of admission to be able to be in a productive relationship with that individual.
Right. So we are basing some of our conversation today. I mean, we decided to have it because we had read an article on a website called Mind Body Green that was written by Dr. Laurie Holman, PhD. The title of the article is How Do You Talk to a Narcissist? A Psychoanalyst Breaks It Down. And she makes a series of points. She said, narcissists will usually only want to speak if it meets their ends. Their ends being admiration, your admiration of them; flattery, your flattery of them; recognition, helping them meet their goals; patience in hearing repeated stories. They tell the same stories over and over again. And if you start getting your eyes glazed over, if you start obviously thinking about something else when you're supposed to be worshiping. If you look like Mike Pence, you can be around a narcissist all day long. That just admiring glance that never challenges or criticizes or disagrees is what they need, they hunger for. So if you are not doing that, or even if you are doing it, but for whatever reason they start to discover it's not enough, then they'll bring somebody else in to tell the story because their energy level goes up. They get re-energized for a new audience because they're shining on these people, and these people are visibly impressed and responding.
And for me, that is classic Murray Bowen kind of triangulation dynamics in communication. We don't have to geek out on that. But that doesn't surprise me at all that they would bring that in. I don't want to break the mood, but I always post these article links so people can look at this. But in the picture on this article, which one's the narcissist? The blonde or the brunette?
Well, the only one you can see is the
blonde,
quasi-blonde, platinum, whatever it is. So,
but I was intrigued by the picture. Which one's supposed to be the therapist? Which one's supposed to be the narcissist? But so for me, what I would be most likely to emphasize.
So can I respond to that for a second? If people are actually looking at the picture. I don't know if you'll know which one was a narcissist or not, but what it reminds me of is when you're doing therapy with people that have abuse histories, and they bring in photographs from their childhood, you can look at those pictures and you can see when the light went out of their eyes. And looking at this picture, it looks to me like there's no light in the eyes of the blonde. And I'm not saying that everybody that's been abused is narcissistic, but I am saying there are those nonverbal kinesthetic dance cues that you have to learn to understand. And so being good at therapy is what I describe as a series of rolling diagnoses, rolling interpretations. You have to be willing to discard them. You're constantly making an assessment about what you're seeing and what you're hearing, and you're trying to hear both languages at the same time. What are they saying to you non-verbally? What are they saying to you verbally? And when there's a disconnect, that's when you know you have to make an intervention. Wait a minute, I just missed something. Something here is not a consistent message. And you have to be prepared when they give you an explanation to discard the assumption that you'd already made. So it's about making a series of rolling assumptions towards a progressive solution. And so you just have to listen. You have to listen on that nonverbal empathic channel. And you have to get an understanding, but be prepared to dismiss that, because as I told a friend the other night who was talking about some decision they'd made, we don't really make always and forever decisions. So you made this decision for right now. It's the best decision you can make for right now, but a week, a month, a year from now, you may make another one and go in a completely different direction, and that's okay. And
you're not duplicitous or somehow
or
selling out.
Yes, exactly. No. So that's not directly connected to a discussion of narcissism, but looking at that picture, it made me think of that.
And, for me, what I want to say to people is that when you are having these connected relationships with any of these people, but specifically a narcissist, because the narcissist is going to be an emotional black hole. So you're going to feed energy into that, and it's going to feel like it's all getting absorbed, and you're not going to get anything back, and you just have to accept that. That's just the way it is. And if you are offended by that, if you say that isn't worth it to me, that's perfectly fine. That is your decision to make, but then you have to know that's not going to change, or it's not going to change for a long time.
Yeah.
And so you just have to be okay with it.
So Dr. Holm makes a suggestion. If you're involved with a narcissist, a boss, a colleague, a coworker, whatever, and you're going to have a conversation with them, and there are 2 paragraphs in the middle of the article that describe what your mindset and understanding need to be, and they're brief. I'd like to just read them.
Okay.
She says, it is important to be aware of wording so that the narcissist doesn't feel slighted, upstaged, or criticized, even constructively, when you engage in a conversation. That being said, most of what you say might not be recognized as it would in an actual conversation. Instead, the narcissist expects what they say to be acknowledged, appreciated, praised, and confirmed. Begin any discussion with a compliment, flattery, or praise in order to get the narcissist's attention. To keep their attention, listen endlessly. This might be hard when narcissists repeat themselves, which they will hardly be aware of doing. And again, I know you hate to be political, and I don't want this to be political, but I'm reminded of the cabinet session that President Trump had shortly after he became president, where all the different members of the cabinet went around and thanked him for the blessings that he gave them by allowing them to have a job. And that's what they started with before they had the cabinet meeting. So, not that I'm making a diagnosis of anybody for any reason. It's just that visible behaviors are being acknowledged.
Absolutely. And, you know, the thing that I wonder then, because... or that I am wondering while we are having this conversation and we're talking about it, is so much of what we rely on when we do therapy is our ability to read nonverbal cues. And that's really the foundation of empathy. The capacity to have empathy is the ability to read nonverbal behavior. I wonder if these people can do that, if they have the ability to do that, and they choose not to because of these personality disorders, or if that ability is beyond them. Because this is what I'm thinking: how can you blame somebody for something that they don't have the physiological capacity to do?
Well, that's a good question, but I think a better question, or at least my understanding, my interpretation of what's going on there, is they want what they get from the relationship, from the job,
right,
more than they want an empathic connection. Okay. So it's a manipulation. It's a use.
And I think that, okay, that may be true, but if the person really genuinely doesn't have the ability, then, because if you're going to be in a relationship with them, would it be easier for that person to be able to say to themselves, this individual isn't using me, this individual isn't malicious, this individual doesn't have the
No, I think
ability.
They have to say, I'm using this individual, I'm manipulating this person. I'll be a sycophant to this person so that I can get my turn at the wheel and do what I want to do.
Yeah, I don't know. I would like to flesh that out with someone who actually feels like that they're in a relationship like that, and to ask them which side of that coin that they would feel like would make it easier for them if they could say to themselves, hey, this person has this disorder that isn't their fault, like autism, and they just can't help it. Or if it would be easier to say, okay, I'm manipulating this person, this person's not manipulating me.
It may not be what you're thinking about, but I'm remembering a couple that I saw where the narcissistic male required the female to maintain a certain body weight, a certain image, to dress a certain way, because she was an accoutrement to his presence. And so there was a lot of aggressive messaging about, you don't want to put that in your mouth, you don't want to eat that, and those are old clothes, get new clothes, that doesn't look right, we have to have this image. And she was distraught because she couldn't have a sense of self. She could only have the sense of being the reflection that he required. And that caused her a lot of pain.
Yeah. And I can understand that. And in that situation, I think it would be really, really hard to say, well, it's not his fault. He can't help it because he's got this disorder. But my hope would be that most people wouldn't stay in a relationship that was that demanding, that demeaning, and in a less demeaning relationship, would it be easier if the person could say, well, this person just doesn't have the capacity, so I don't expect them to be able to do these things that I might expect other people to be able to do.
I think you tell yourself that as much as you can,
Yeah.
and can cover most of the pockets, but there's always one pocket that hurts pretty badly.
Yeah, that's probably true. All right. Well, we hope that this has been a beneficial conversation for people. And if anybody out there feels like that they are in this relationship and would like to either share with us or even be on the show and to talk about that, you can always get a hold of us through the website, www.psychwithmike.com. The music that appears in Psych with Mike, as always, is produced and is written by Mr. Benjamin DeClue. And as always, if it's Friday, it's Psych with Mike.